Fast and simple dosing calculations will save children's lives. This is DosePerfect, a senior design project by Emmanuel Chukala, Kwong Nguyen, and myself, Eric Nelson. Unfortunately, medication dosing errors can occur in up to 17.8% of all hospitalized children. In emergent care situations, this could be even higher due to the high stress and time-sensitive environment. The current solution to quickly decide medical dosages is the Broslow tape, a paper tape used to determine the height of a child and estimate the dosage required. While useful, a paper tape can add to the confusion of an already stressful situation by having multiple dosages listed for slightly different ages and weights of children. DosePerfect calculates and presents dosages for a single patient at a time, with no other visible dosages for other age or weight patients, reducing potential for error. This software was the idea of Jerry Brummett at CU Health, and our senior design team turned an early prototype into usable software which is simplified, polished, and designed around easy maintainability in the future. For our project, the research phase was mainly investigation. Dosing calculations is a solved problem, but we had to determine edge cases, the requirements, and stay within FDA regulations. We designed a simple and easy to modify React application as the base of DosePerfect. In order to stay within FDA regulations and for safety, all dosages are based off of published data. We intentionally stored this data as human-readable and editable JSON objects, as you can see. The benefit to doing it this way is future medications are trivially easy to implement, as the maintainer can simply type in a new medication in this format.
Input validation function will help to reduce human errors, especially in the hospital with kids. If doctor and nurse enter the invalid kids weight and age, DosePerfect application will show a pop-up let them know they entered the invalid weight and age. For example, a 1-day-old child weighs 5 kilograms will be out of range of weight and age, so our application will let the doctor and nurse know about that. But there is some exception, okay, that a child with 1 day old will weigh 5 kilograms. So we design our function with override feature. That means if the doctor enter the out range age and weight, our application will let them know they enter the outbreak input and asking them if they want to proceed with their input or try another ways and age.
Hi, in this slide I'm talking about UI design. The UI or the front end of the project is written in React.js. There are many clickables and items that needs to be shown. In this project, we have tried to hide some of the contents by organizing, similar items like similar medicines, for example. Uh, this is in order not to overwhelm the user. At the end of the day, the app is intended to be used in ER environment where focus is critical. So the user can also submit their comment or question by clicking the feedback button located at the top right corner, and their message is directly submitted to the take contacts email. So the only user interaction that needs a backend support is the feedback mechanism. As a result, we have used Express Node.js to write the backend that is responsible for this specific task.
Disseminating our application to human testers was extremely helpful. As dosing calculations were a solved problem already, this was focused around functionality, user interface, and the experience. Significant changes were made following tester feedback, both in the look and feel of the application. Changes were particularly important to make the website as intuitive to use as possible with zero instruction. We did have some challenges during this project. For one, edge cases. We had to consult with medical professionals as to how to dose the child if they didn't fit into the standard weight and age combination boxes given by the medical community. Data availability made adding medicines difficult, and future maintenance needs had to be addressed during the project so that DosePerfect would be actually useful as a product going forward. After surmounting these challenges, we ended up with a product that was simple, streamlined, and effective. It is ready for use with nothing more than some additional medical data being entered, and we are extremely excited to see it used in the real world. Many thanks to our project sponsor, Jerry Bremet. We wish her all the best with this project in the future, and thank you for listening to this presentation.